I'm a birth and postpartum photographer, and I'm here with Elizabeth Cook, who's a midwife, and we are going to answer some of your questions today. So the first question I guess I want to ask is mine, and I know that there are just so many things with postpartum. I think everyone kind of thinks that it's just postpartum depression, but there's, postpartum anxiety, postpartum OCD, postpartum psychosis. I think that's a really popular thing that people are wondering about, and so can you just talk a little bit about the baby blues and the difference between baby blues and postpartum depression?
I think baby blues are the most common things that postpartum moms experience. There's such a hormone shift that comes after having this baby, and really your hormones just drop, and about that 2-3 week period is where they hit their lowest. It's a lot of physical, emotional stress on you, and the baby blues tends to manifest itself as just your hormones are just lower and you're exhausted, and you may cry for seemingly no reason at all. It's the little things though, but you can keep going and you can keep functioning, and life is still good. Then I think you move into the postpartum depression piece, where it's just a little bit harder to cope. Everything is just too overwhelming. You don't feel like you're really your normal self anymore. Other people may have to start intervening a little bit here or there. That's when some counseling or therapy or even some medication can help, even if it's just hormone support, like some progesterone supplementation or other herbs or essential oils can help too. And we spend so much time on the prenatal aspect of childbearing, we forget that there's the whole postpartum aspect. In fact, ACOG really beat out the midwives this last month when they put out a statement saying that there needs to be more follow-up with women postpartum.
Yes, I agree. I think that so many mothers like to just pretend that everything is totally fine. Even if you ask them, like, how's postpartum going, they'll always tell you, it's great. And then I always ask, but how is it really? Or I'll say, like, really? Because for me, it was really hard. And then they'll kind of open up. So I think that just being able to talk to one another and have that support, like you're talking about, it really does take a village to raise a baby. And that's okay to lean on one another. We have a question from Jenna in San Diego, and she says, because I had depression and anxiety before pregnancy, could I be more prone? Will I automatically get PPD or PPA?
You're more prone, but you're not guaranteed to have that postpartum depression or postpartum anxiety. Knowing that it's been there and that that's a tendency for you is the first big thing, just to realize what it is. And having your resources available in advance. Know that it may be needed to take medication postpartum because you have such a big hormone shift. It's not all just you, it's not all in your head. Sometimes it's a chemical piece that needs to be addressed. And if you have support people, counselors, therapists, friends, family, whoever you turn to and lean on is going to be helpful.
Yeah, I think that knowing ahead of time that this might happen, so let's prepare our support system is really key. At least for me, with having postpartum anxiety, we had already kind of known my triggers. So like if something was coming up, I kind of knew that something else was going on. So our second question is from Meredith in Des Moines. She said, my last baby was a little more difficult birth with complications. So I'm having anxiety about going through childbirth again with my next child. How can I ease my anxiety?
Having a conversation with your midwife or physician, your doula ahead of time, so that they know where you're coming from, what your frame of reference is, and how you would like things to be different is huge. And then, the piece of self-preparation ahead of time, reading books, reading stories that are encouraging, seeing that other people can do this and you can do this, and learning the tips and the tricks that they use to get through. So whatever it takes for you to let go and let it happen and relax and be comfortable and confident and calm in your own space is going to be key to getting through.
I had a lot of anxiety surrounding my second birth because I had kind of a traumatic first birth. And after my first birth, I found Birth Without Fear, which is an incredible resource. And that really taught me a lot about birth and, having respect in your birthplace, and just prompted me to educate myself more. And being a birth photographer, obviously, I've been around a lot of births, but that really did help.
And then you can use that to help other moms that are going through, and realizing that birth isn't a cookie cutter for everybody. We need to use a different approach, for each individual birth experience is crucial.
Yeah, because every baby and every mom is so different that you never really know how it's going to go. Okay, so our next question is from Cassidy from Detroit. What is the difference between an OB-GYN, a midwife, and a doula, especially when it comes to emotional support?
So a doula, I think of as a birth coach. They're there to provide that emotional support, that physical support through position changes, helping you stay hydrated, helping you stay nourished, helping you understand the process, and connecting with your whole birth team and understanding what your midwife or physician may be looking for. A midwife is trained to provide care to low-risk healthy women, which according to the World Health Organization is about 85% of moms would be suited to midwifery care if they wanted it. So we learn the breadth and depth of maternity care as it applies to anybody who essentially doesn't have, a lot of pre-existing conditions and comorbidities and all that, but, birth the way that it naturally was designed to unfold. So OB-GYNs are medically trained to provide care across the breadth of obstetrics and gynecology. And their forte is really in the high risk, doing cesarean births or operative births or moms with severe blood pressure issues or diabetic issues, all that. We need everybody in it together. Everybody has their forte. Everybody has their strengths, and we rely on each other to fill in and support each other.
So our next question is from Lucy from Austin. I know there's no right way to parent, but having Google and the millions of contradictory opinions online makes me even more nervous. Everyone seems to have a different opinion, and it's giving me anxiety before giving birth.
What do I do? It's true. There are so many stories out there, so many opinions, so many different ways to approach birth. The majority of births are just beautiful and straightforward and natural. And to focus your preparation, your attention, and what you watch and what you listen to on being supportive of you no matter how it goes. And you're going to have what you need in the moment to get through. You're going to have the inner strength, emotional strength, and the support around you that you need.
People are always overwhelming you with like, well, did you do this or you should do that? And it can be really overwhelming. And so sometimes you just have to nod and say, okay, and just do whatever you want to do or what feels best for you. Because ultimately there's no right way to do anything.
Right. One of the most common phrases that I think I use for moms in labor is just let it be. Just let it happen. Just let it go. That's the same thing you need to do with all the stuff that's going to come at you and bombard you. Just let it be. Just let it happen. Just let it go. You have what you need.
So that is all the questions we have for today. Thank you so much for coming on and answering all of our questions.
You're welcome. It was a privilege to be here. Thank you so much.